Okay.
Hi everybody, we're talking to you guys, you diamonds out there. We've been asked a question. We're going to say it's an anonymous question because it's a brilliant question. It's something that we've come up with before. And this whole question is why Tracy and I put Diamond Pilates together, because it's not normal Pilates, particularly it's not traditional Pilates, and also because there was so much in the media about high tone pelvic floor. And if you remember on the course, if you look in your manual, we do talk about high tone, and we also talk about high tone saying, I don't know Tracy if you agree with me, that Diamond Pilates is not for people with high tone. Yep, we'll stop there. But the actual exercises, not the Pilates exercises, sorry, not the pelvic floor exercises, but the Pilates exercises we do would help somebody. I don't know, agree, Tracy, if somebody came to a class and they did the physical exercises but worked on relaxation of the pelvic floor rather than contraction, that would be beneficial, but not joining in the whole Diamond Pilates programme. So this is the question, it's a good one. I attended the Diamond Pilates workshop a couple of years ago and I am very much bought into the principles and the ethos behind it. I have run several workshops now and all of the clients seem to have taken something useful away with them, remember that. However, recently on social media, particularly Instagram, I have encountered several accounts which are generally very much against Pilates instructors teaching clients Kegel-based programs. So that's the first part of this question. So I'm going to let Tracy answer that because she's cleverer than me.
I think historically, when Pilates really first came into the wider spread fitness arena, there were a lot of organisations and trainers that were pre-queuing pelvic floor and TA activation for every single exercise, be it an arm float or a breath or a bridge or a standing movement. And I think what the message that came away was that people should be contracting their pelvic floor muscles all of the time. As well as their abdominal muscles. But that's not really how the body's designed to work. The pelvic floor should work appropriately and it should be able to contract and relax and be spontaneous. So I think the problem with Pilates instructors, the reputation has been, is that they teach core or pelvic stiffness rather than a responsive stability. We came away from that a long time ago, and on your course we very much talked about the ability of relaxing and contracting the pelvic floor. And I certainly know that Cherry and both Cherry and I, we don't pre-cue pelvic floor unless it is with purpose, so not as a precursor to any other movement. And I think the reason why Pilates teachers came into the firing line for this was that years ago we definitely did used to teach people that they should always contract their pelvic floor before every single movement, and that's not an appropriate way to treat any muscle.
So if that makes sense, and if you look at what we do, and particularly have a little look at some of the just clips that I generally do on the Facebook groups, we don't always, as Tracy said, be saying contract this 30%, contract this. We try and get it, say instance on a foot lift, to visualise the movement and then to do it and work on keeping the sacrum still, rather than saying keep the sacrum still by lifting up on your pelvic floor and contracting your abdominals. That's the first part of the question. Second part of the question, excuse me because I can't read a thing without me Ronnie Corbett glasses on. The key issues being raised by these individuals, and they're valid key issues, aren't they, is that the belief that most incontinence issues are a result of overtight pelvic floor muscles, which are subsequently unable to relax and then contract appropriately. Their recommendation is that with incontinence issues should always be referred to a women's health physiotherapist. And we say that on the course, don't we? If somebody's got real issues, get them referred to a women's health physiotherapist. In this area, they wait 3 months. They go and see the women's health physiotherapist and they see them for one session and then they see them for a follow-up session and then that's it. And we would like people to then be able to come to us to maintain their programme of exercise. If it doesn't work, then it could be that they need to get re-referred back to the women's health physio. But we do agree that lots of people do have high tone, and I'm going to let Tracy talk in her experience as a women's health physio, some women do have high tone, but lots of women don't.
Yeah.
And I class myself as one of those women that has to work on maintaining, and because I've got no hormones, etc. But I'm going to go over to Tracey to talk about her side as a women's health physio.
So I think there's two key issues here. The statement that most women suffer from incontinence because they have a tight pelvic floor is simply untrue. I see an awful lot of women with very, very weak, poor contractility of the pelvic floor muscles. I do see some women that are overactive and have high tone of the pelvic floor, but the vast majority sits in the very weak, unable to elicit a contraction or a contraction with endurance because the muscles are loose, because they are overly relaxed, they are lacking in tone and the ability to contract. So that's issue number one. Issue number two is, on our Diamond Pilates course, we teach you how to allow women to, men and women, to assess themselves whether they are able to contract and relax their pelvic floor muscles. We know that only 1 in 3 women will ever seek help, and sometimes it can take up to 10 years before they go and seek medical help. Not all women will get a referral to a women's health physiotherapist actioned by their GP, certainly in the first instance, and if they do, they have to wait a long time. The Chartered Society of Physiotherapy issues patient leaflets that women and men can access themselves. You have the links for both the male and the female leaflets in your course manual. So the Chartered Society of Physiotherapy understand that women and men don't always seek help, but they want to give them the tools to be able to self-assess. You have these tools in your course manual, and you are taught on day one that the very first thing that we want people to be able to do is to assess their own pelvic floor. You cannot tell whether somebody is contracting their pelvic floor a little bit, a lot, incorrectly, bearing down, or not relaxing it. But there are tools that you are given to send people away to be able to self-assess. Having done that, we highlight the fact that if somebody can't feel that they can contract their pelvic floor, or can't feel that they can relax their pelvic floor, that you refer out, that it's not appropriate for them to be coming to a mainstream Diamond Pilates class working on pelvic floor if they have no idea whether they're contracting or relaxing at all.
And my follow-up to that is that what we do say all the time on Diamond Pilates, on the course, and we encourage you in the class situation, and it's on the student, your client's handouts, is that if they attend Diamond Pilates and it increases any pain or any symptoms that they have, that they inform you and that they seek medical help. Those are just the first bits of it. We're going to talk about the other bits later on, and I think what we have to accept is that some people do have high tone, some people have low tone, and when we do our work and when you guys do your work, somebody might come up to you and say, I think I might have this high tone. What we might do, they might have just thought that they were odd, something wrong with them, not the same. And if we can at least allow them to know they might have high tone, then they could go and seek help for that, but otherwise they might not. So really what we're doing is trying to educate as well, and it is a massive field, and it's one that we bounce around all the time, but the message that everybody's got high tone was completely the reason that we developed Diamond Pilates. So thank you for your question, brilliant, and then we'll get back to you with the other part of the question.